Anyone can be trained to give rectal medication or intranasal medication. You may also be given a medication that you can place on the tongue that dissolves. So this is rectal diazepam. And when you pick it up from the pharmacy, that you'll notice that there are 2 doses in here. In addition, there is also some lubricating gel and some directions of everything we say here today for reference for you. So these are some trainers. There's no medication in them, but we can go through and look at a few things. First, when you've gone to the pharmacist, when you take out the medication, you want to ensure you have the right dosage and that it's ready to use. So let's look right first that you have the correct dosage. Do you see the dosage window on your syringe? Yes. Good. You'll check that first. The second thing you'll check is to be sure that the green ready band is visible. Can you see the green ready band on your syringe? Yes. Just to make sure that it has it ready. If you do need to give the medication, you're going to take 1 dose out and you're going to use that lubricating gel we talked about. You'll open the lubricating gel and put the tip inside. So let's open it using your thumb. You can put the tip of the syringe right into the lubricant. You can leave it there as you carry it over. So now you're ready to go. The best way to handle this with your child is that you're going to have them on their side and you're going to roll them towards you. You might even want to bend their upper leg so you have a little bit more access. Then you'll take that lubricated syringe and put it into their rectum. It's going to take a little while to put it in. We want to go slowly, and so we'll count slowly. 1, 2, 3. Once the medication is in, we're going to leave the syringe there for another 3 seconds. I count of 3 slowly. Count with me. 1, 2, 3. Now we can take the syringe out, so we'll squeeze the buttocks together and then take the syringe out. Again, another slow 3. 1, 2, 3. And that's it. You can dress your child again and then stay with them, put them in that recovery position like we've talked about with seizure first aid. There are 2 medications that might be given intranasally for rescue therapy. They are diazepam or midazolam. The medication is intranasal, just a fancy way of saying it goes up your nose, so it's very easy to give. The medications are benzodiazepines. That's a class of medication that works very quickly, and so it has a good success rate. So this is the device. It's very easy to use. You'll put your 2 fingers right here on the side, and then this is the plunger. You don't want to depress the plunger until you're ready to give it. I'm going to show you what it looks like, and then I'll have you give it to yourself if that's okay. All right, so you'll see how that atomizer works. It's a very gentle spray, very easy to give. Do you think you're ready to try? Sure. Okay. So what I want you to do is hold it just like I did with your index finger and your middle finger on the side, and then your thumb here. Remember not to press this until you're ready. When you're putting it up your nose, you want to go all the way until your fingers touch the bottom of your nose, and then you're going to press it very quickly, just like I did before. So put it right up your nose, very good, till it meets your fingers. So now you'll depress it with your thumb very quickly, and you'll feel that spray. Terrific. Sometimes a second dose is required. Your seizure action plan will tell you when.
If you have epilepsy and are going to school, or as a mom, you have a child with epilepsy, important to talk to the school nurse about what the seizures are like, what rescue therapy was prescribed, the dose, and how it's to be administered. Find out, can the nurse give you the medication if it's needed, or can give that to your child, or can they train someone else to do it? And also make sure that they know what your typical seizures are like and what's not typical, or when to give you that rescue therapy. And then most importantly, please ask them to track what happens when they take it, because you need to know if it's working, and you want to tell them at home what's working. So then you have all that information that you're armed with to talk to your provider and say, yes, do we have the right plan? Or gee, this isn't working as prescribed. What do we need to change?
Rescue therapy is available and it's there. You have something to go to in the event. Its goal is to help abort your seizures. Its goal is to help keep you out of the hospital. And its goal is to be able to help you feel more comfortable to know that in case I need anything else, I have something available for me.
So working with rescue therapies means learning that skills, learning the know-how on how to do it, but also how to monitor it, and then how to take that information back and talk with your treatment team.
Tell the doctor that you're informed, you're an advocate, and you want rescue medicine for your child because you know that epilepsy can evolve and the seizures can evolve into all different types unexpectedly, and you want to be prepared. Make sure that you not only keep that rescue medicine on your person and on your child, but that you also provide it to the teachers and to the counselors that may find themselves in a position to administer that to your child. And lastly, make sure that once your epilepsy person has capacity, that they carry that with them and that they know how to use it, and that they inform the people around them that they do carry that and this is what needs to happen and when that should be administered.